Welcome to the Long Story Longer podcast.
I'm Dominic Marano. I prescribe meds.
And I'm Brzyzowski, and I provide psychotherapy.
Long Story Longer is a podcast about mental health and navigating medication, therapy, and whatever else we want to talk about.
We will discuss topics from each of our perspectives. We will try to keep it to 15 minutes.
But it will probably be longer. Hello and welcome to the Long Story Longer podcast. My name is Dominic Marano. I am a family and psychiatric mental health nurse practitioner. I own my own psychiatric practice and I have a doctorate in the nursing practice. I've been in healthcare for over 20 years and more recently into mental health.
Hey, I'm Brzyzowski and I'm a licensed clinical social worker and I have a doctorate in clinical social work and I own a private practice and I've been in the mental health profession for over 25 years.
Welcome back to the Long Story Longer podcast. Today, we are going to talk about narcissistic personality disorder. We talked about that before in pop psychology and got a lot of feedback about that, wanting to dive into that more. I do want to preface this by saying your own experience with mental health and mental health diagnoses are your own. We're not saying that you don't have any specific mental health diagnoses or encounter someone with any specific mental health diagnosis, but just on the broad that sometimes things can be used out of the way the DSM-5 intended them. So today we want to go a little bit deeper and just say that it might not be that one guy you dated who vaped in your face and then ghosted you, but it may be something a little bit deeper, a little more traumatic.
People can be narcissistic, but that doesn't mean they have narcissistic personality disorder. So we're getting into the real stuff. Like, what is NPD, narcissistic personality disorder? How does this show up? What's it like from both the psychotherapy perspective and the psychiatry perspective, Dom? And it's not just about ego. So a person with narcissistic personality disorder, there is a lot of shame. It's just extremely complex.
Great. So what we'll do first, and from a psychiatric perspective, I think we're more or less going to look at diagnosis. There's not really any specific medication for narcissistic personality disorder, and this is where, therapy comes in really, really, really handy.
Do you think most people realize that? Do you think people understand? I think it's interesting because not all, and I think we talked about this before, that not all mental illnesses or mental health conditions can be treated by medication. Only some of them. If it's personality disorder, it can't be treated. It needs therapy.
Yeah, and then that's not to say that you can do symptom management.
Yes.
Yeah, the actual mental health diagnoses, from the personality clusters, MPD or narcissistic personality disorder is classified as a cluster B personality disorder in the DSM-5. There's also borderline, antisocial, histrionic. They all share traits about emotional intensity or interpersonal drama or instability to some degree. It's thought that when the mind develops that there's some sort of pause or incident that causes the personality to adapt in a maladaptive way, have some coping that isn't necessarily the most effective and can actually cause more harm than good. But, in terms of medication, I would say that it may help with symptoms, but I tell everyone some of these personality disorders thrive on anxiety. And if you help anxiety, you may help the personality disorder to some degree.
That's a really good point.
Yeah, that there's a scale that tips that any under the umbrella of anxiety disorders, and anxiety is associated with some of these personality disorders as well. Medication has a very small part, I think, and in terms can be supportive, but not necessarily the greatest in terms of treatment. So, Katie, how does one get diagnosed with narcissistic personality disorder?
Well, in order to get a true diagnosis of narcissistic personality disorder, PD, we'll call it that from now on, so I don't have to keep
it's a mouthful.
Yeah, it is. So, in order to get diagnosed with NPD, the diagnostic criteria in the DSM-5 says that you have to, and with any personality disorder, so you have to meet different criteria. So they basically, they give a checklist, you have to have these problems, and they have to be impairing your ability to function in some way, impairing your relationships. It has to impact you negatively somehow.
And consistently, right?
And consistently, exactly. So what they say, it's a pervasive pattern, right? So you think a pervasive pattern of grandiosity, either in fantasy or behavior.
And grandiosity is basically things are bigger than what they actually are. So that
Exactly.
kind of like when people say grandiose things, it's like, you know, I love it when people are dramatic and it'll be like, it's the end of the world, and it's not. In narcissistic personality disorder, I think it's more or less about the self, where the person will perceive themselves bigger than what they really are.
Exactly. Like I was the most important employee at that job. Like if it wasn't for me at that place would have, you know, shut down and wouldn't have been able to survive. But not just in one incidents, but like for everything. That's really how they kind of conceptualize. They walk through the world and conceptualize it that way, that they were very, very important. So yes, so it's like you exaggerate your achievements or your talents, and you really expect to be recognized as superior because that's what you think of yourself. It also, there's not necessarily like, you know, achievements that make sense for that. So it's not even like they're coming by it like, you know, in a genuine way. It's like they maybe weren't the best employee at that place, right? They just think that they were.
Yeah, and grandiosity can be in the form of lies, just blatant lies, or an over-exaggeration of something that exists.
Exactly.
So say you were able to run a mile. Well, I ran the fastest mile faster than anyone else in the world. Well, not likely.
Exactly.
Well, maybe for the fastest person, but...
Yeah, someone it's true, but everyone else it's not true.
Yeah, everything feels bigger than what it really is or should be.
Exactly. So basically, the broad definition is you're going to say it's a pervasive pattern of grandiosity, of need for admiration, and lack of empathy. So those three things really: lack of empathy, grandiosity, and need for admiration. And this all starts early adulthood. So if somebody's like doesn't exhibit any of these things until they're in their 40s or 50s, it's probably not actually a personality disorder, because this is like how your personality is kind of set.
And then just to talk about the difference between empathy and sympathy. I think a lot of people they confuse them.
Oh, yes. So do you want me to talk about this?
Yeah, go for it.
Okay. So sympathy is like, I feel bad for you. I'm sorry that you didn't, you know, that this happened to you. But empathy is really being able to put yourself in that person's shoes. So you can really have empathy. Like if I say that, you know, you don't look good in that dress, then how would that person maybe feel? They might feel like that, you know, they might not want to go out that night, or they might feel better. And I don't want them to feel bad, so I'm not going to say that. And so, you know, that's a silly example. But having empathy and lacking empathy, as we all know people that do lack empathy, and not everybody there's a continuum, of course. Some people are too empathetic, right? They feel everything everybody else is feeling all the time. That could be problematic also. But to not be able to put yourself in someone else's shoes is, you know, you can see where that could cause problems, right?
Sure. And I look at things as sympathy is you can't picture yourself experiencing that, but you do feel bad for somebody.
Exactly. That's a great way to say it.
And then like almost like when I think of it from funerals, like you send a sympathy card, because some people might not have experienced a loss that deep before. But if you're empathetic
you
enough,
send an empathy card.
yeah, you don't send an empathy card, you send a sympathy card. But and again, probably sympathy because it's the person's own experience, that even if you wanted to imagine, like people may have lost their mothers, but everyone may have a different relationship. Some people will not be able to put themselves in an empathetic role. But to give sympathy,
anybody can really have sympathy,
yeah,
right?
Yeah. Empathy is like a deeper version of sympathy, in my opinion. Like it's just it takes the experience versus just a feeling, you know?
Exactly, because even if you haven't had that experience, you can still have empathy, because you can just kind of imagine what it would be like to be that person, and then feel that for them.
And the narcissistic personality disorder, they're incapable of doing that because they're just so enwrapped in their own existence and can't go beyond their own selves.
Exactly, which is why it's like such a major part of the disorder. And so then we have the DSM, which you've probably heard us talk about before, and we will continue to talk about, which you've actually absolutely heard us talk about before. Every diagnosis has like a checklist essentially, and they'll say like you have to have 4 of these 6 things in order to be diagnosed. So this is like from our perspective as we're diagnosing clinically, we will look at this. So in order for me to say someone has narcissistic personality disorder or to NPD, I'm gonna keep messing it up, NPD, and then tell the insurance company that for a client, right? Like I need to make sure that it's accurate, and so it would mean that they have to have 5 or more of these in this this checklist for narcissistic. So grandiose sense of self-importance, that's number one. Preoccupied with fantasies of unlimited success, power, brilliance, beauty. Believe that you're special or unique in some way. You can only be understood by certain people or associate with certain people. Requires excessive admiration. Has a sense of entitlement. Basically that they have really unreasonable expectations of getting some type of special treatment because of how special they are. And again, you don't have to have all of these to diagnose. You just have to have 5 of them. Exploits people for their own gain, lacks empathy, envious of others, or believes that others are envious of them, and they are maybe arrogant, haughty, in their behaviors or attitudes. So those, in order for us to diagnose, we really need to see that 5 of those exist and that they are pervasive. As far as diagnosing like covert narcissism or malignant narcissism or those other things that you might hear on social media, they aren't in the DSM. Those are people, psychologists and therapists and social workers, they've come up with this since, but they're not actually in the DSM. So you wouldn't get a diagnosis of you are a malignant narcissist. They're like categories after the fact.
And it's really hard. I think the idea of covert narcissism comes from a place of it's hard to tell when people are lying or not. You expect people to come into your office and be forthcoming and honest, but if they're just trying to either A, cover up something, or B, put this false persona that they have that just makes them helps them cope through life maladaptively. I think it's difficult. And I think for most personality disorders, particularly from a psychiatric realm, we exhaust. It's like a diagnosis of exclusion. If you don't meet other criteria for things, because as I said before, and I'll beat it to death, there's so much overlap with mental health diagnoses. Like, for instance, sometimes with bipolar disorder, people have grandiosity. So are they...
Sure, and mania?
Yeah, mania. Is a person manic or are they a narcissist? One of the things is that when we talk about these checklists, it's that these are consistent patterns of behavior. Something, again, I think a lot of times, unless someone is like textbook narcissist, we may have a case study about that later.
Yes.
But if somebody's a textbook narcissist from the jump, it's really hard to tell that's where the covert comes from. It's not, the diagnosis is the diagnosis. It's kind of getting to the truth of it in the person.
They also will call covert narcissist vulnerable narcissists. That's like another word for that. And so basically, yes, they may be arrogant, but they're also more introverted and maybe more sensitive, which throws you off.
Yeah.
Because we think of narcissists as being very, extroverted, but they may not be that way.
Yeah, it's like a paradox. That's the deepest form of human feeling, is being two opposite feelings at the same time.
Yep.
So that's narcissist or a paradox. Could be in that situation. So just some stats. It affects anywhere from 0.5% and 6.2% of the world population. It's more commonly diagnosed in men. And I think we can kind of see that sometimes the macho personality or those traits of being masculine, toxic masculinity is in essence narcissism to a degree.
Yes, that's a good point.
Can also coexist with depression, substance use, and sometimes some other personality disorders. So there can be some overlap. And that's why I say sometimes with medication, when you help with the co-occurring issues, that sometimes it can be misleading because you've helped with some symptoms, but it's not really that whole personality disorder.
And, if you think about it, it makes sense that there would be depression or substance use or those other co-occurring disorders with NPD because it's gonna mess up your relationships, right? You're going to end up with difficult interpersonal relationships because if you have no empathy, people that do have empathy and people who expect empathy in return are not going to love this, right? Mm-hmm. And so it's going to be, it is going to be problematic at some point. It's going to show up, and really, it needs to affect you negatively to be the actual narcissist.
Yeah, and like you said, just kind of hitting the nail on the head, because when we go forward, we're going to look at a little how people are viewing it versus actual clinical reality. The traits need to be persistent, the cause of real distress or dysfunction in work relationships or sense of self, and very inflexible personality. So it's just not you being a jerk. Personality is very assertive, aggressive, unwavering. So these things, and problematic, more or less.
Yes. Which actually is why I have very few, if any, actual narcissistic NPD clients, because, to be honest, they don't really show up in therapy because they don't think there's any problem.
Yeah. And then don't take criticism very well either.
No, because they're the best at everything. Why would they? What would you be criticizing?
The maladaptive coping mechanism, when you criticize something, it weakens the whole foundation of I'm the best. You can't be the best if you have criticism, right?
Exactly.
All right. So now, moving forward, I kind of alluded to it. Elephant in the room, or in the Instagram, I should say. Narcissist is like the buzzword for an insult. We've seen a number of different places. It's just growing exponentially. I think that the Google searches for narcissists since 2015 have increased tenfold. And TikTok is like your pop psychology 1 minute psychologist or psychiatrist or therapist is always warning people about exes, friends, bosses, parents. So it's good. I think we mentioned this before about pop psychology, that putting it out there for discussion. But like I said before, making sure that you're calling someone an appropriate diagnosis versus just name calling, because it's very easy. People love to put people in boxes. People love to label anyone just because that's how the brain works. It loves to sort things out.
Right.
However, there's a difference between someone who has maybe a trait versus an actual diagnosis.
Exactly. That's very, very important. We all have narcissistic traits, right?
For
We
sure.
all act in a narcissistic way sometimes. But if you have a full-blown personality disorder, it's very different. So you shouldn't be really calling people narcissist or saying that person's a narcissist. I mean, you can if you want, but I mean, you shouldn't. It's not really. You're weaponizing it at that point, and why do that? So, but I do think you can say someone has narcissistic traits, and then I think then you can go ahead and use all of the really. There's a lot of really good psychologists and therapists and psychiatrists out there on social media that are giving really good information about this. So way more experienced in this area than we are. I would definitely have you go to them, but I wouldn't. You can even use their information even if somebody has narcissistic traits, but maybe it's just not a narcissistic personality disorder.
Yeah, and think about it. The best way to disarm a narcissist, which we'll get into, but it's not to just point them out and name call, because that's only going to feed their fire.
Oh, for sure.
Yeah. So, I mean, let's talk about that. Like, how does one become a narcissist? Where does it come from? You alluded to that before, but, personality disorders are born out of something. Where does this come from, Katie? So, Katie, what is going inside the head of someone with narcissistic personality disorder?
Well, basically, they just have a lot of shame and they are very sensitive. They're vulnerable. They have these feelings under the surface, but they don't know what to do with them. And so instead they want you to think that they know that they're fine or that they're fine, but they don't feel fine. But so they instead are going to be grandiose. They're going to do that as a survival strategy. They're going to say, I'm so great. They're going to tell the world how great they are because deep inside, they know they don't think they're great. So they're going to try to convince the world that they are.
Yeah, I think there's a psychologist, Elsa Roningstam, who wrote about defensive self-enhancement, where grandiosity is a survival strategy. It's you pretend that you're Superman, so people think you're Superman, but you're not.
Yep.
So I think that, like I said, in terms of the clinical setting of it, it's really can be tough to weed out. I also think too, you have to get into a pattern of behavior and seeing how someone acts and behaves, unless there's a textbook right from the jump.
Yes.
Person who comes in.
I had a textbook right from the jump person.
Yeah, so why don't you give us a textbook, give us your experience with that, and maybe it'll lay the groundwork for people can kind of understand what a true person with narcissistic personality disorder looks like.
Okay, so I think I really only had one true narcissistic client, and I only saw them twice. And at the end of the second session, I knew that I couldn't see them anymore. They were only there because their girlfriend at the time said, if you don't go to therapy, then I'm not going to stay with you. So, he started seeing me. And in the first session, Dom, within 15 minutes, he told me how he was the best person at his job. He was the best, the handiest person. He was everything was great. Then he told me how big his penis was, how great he was at sex. Now it was very scary, and we were by ourselves. It was just me and him in this little office, and I was trying really hard to just be present with him and listen to him, but I was a little frightened. But he wasn't super aggressive. He was just very, very clearly believed all of this and wanted me to believe all of this. And he said he told his girlfriend he had been going to therapy, but he hasn't. I was his first therapist, but he wanted me to tell her that he had, which of course I'm not going to be complicit in that. But either way, I decided to see him a second time. He walked out of my office and I thought, I am not prepared for this. I can't handle this. He also told me he would not see a male therapist. He would only see a female therapist. I'm not sure exactly what that was. Maybe he thought
It's
he could
like
have the
power
upper hand.
dynamic, yeah.
So he left and he came back for the second session. And I was already stressed and nervous, and I tried to prepare as much as possible for the second one. And during the second session, he did the whole thing over, telling me again about his penis, telling me how great he was at sex, all of the things. And then he told me that he never hit a woman, only once, but she deserved it. And at that point, now this is not to say that everybody who has NPD is also, violent or abusive.
Physically abusive.
Yes, this is not to say that. This happened to be the case here. At that point, I ended the session and told him I needed to refer him out because I wasn't prepared to deal with that. So I didn't say it exactly like that. And I think he said you could tell he felt very hurt when I told him that I wasn't going to work with him anymore. He was like, this is what he said. He goes, "You're firing me? You're just going to leave me? I say one thing you don't like and then you leave me?" And I was just like...
And that validated that diagnosis. That was that. Now, the shame that he felt because his false persona now failed, and that everything that he's used to, doing, and it is a gamble because I think the truth comes out sooner or later about, that's what's hard about narcissism, is that they play the role so well until they don't. There are moments where it happens, and I do believe, like you said, it's not, they know that their false persona isn't true, but they're very convincing actors even to themselves.
Mm-hmm. Yeah, exactly.
So and you mentioned the girlfriend at the time who wanted him to seek help. A lot of times narcissists have fed off of this false persona, these maladaptive coping mechanisms of being grandiose, that they don't want to change it because they see so much secondary gain from it.
Yes, and they don't really think there's a problem, right?
Yeah. I mean, I think deep down inside, like, that guy is an example of, like, it has to fail. I think the problem exists there in some, I mean, textbook says it doesn't. It says it doesn't, but I don't believe that. I believe that people know that they can act a certain way, that they're not being their genuine selves, and that deep down inside, there's a scared person there. There's someone who is, that rejection they can't deal with, because not everything in life is going to go the way. When you're not the best, say, for instance, all right, I'm the best runner in this group, you run and get beat. Well, you're not the best runner. Now your feelings are going to be hurt. Now the truth is going to show. And when the truth shows, that's when those super defensive mechanisms come into place.
Right. And then anger and different things.
Sure. And then, you mentioned the relationship itself. Within close relationships with someone with NPD, it can be incredibly destabilizing. There's a couple occurrences. Love bombing. This is when, very meticulously, very manipulative, it's this affection that has been missing in your life one way or another, and it's powerful and it turns on, but then all of a sudden it kind of goes away, and it's strategically placed for when the other partner's like, for instance, in your example's case, they were like, you need to go to therapy.
Once his true self came out, because he could pretend
you can pretend for a little bit. And that's like, and when in arguments, something called gaslighting, which we talked about before in pop psychology, this isn't being triggered. This is someone systematically using a way of manipulation to make the other person question their reality. Like, I'm not abusive. You're the one who did that. Mm-hmm. I don't talk down to you. You're just not secure enough.
Exactly. That's where you hear all the trips of you're too sensitive and, you're overreacting. And that is something a narcissist would say.
Devaluation. Like, it's so stupid that you like that. You'd have to be really dumb to want to do something like that.
Yep.
Really just devaluing someone's interest or ideologies or anything like that.
And then if the person gets upset that they said that, then they would be like, I don't understand why you were upset, which would be the emotional invalidation, right? Like, why are you upset that I said that? I was just saying this, and then that's the gaslighting too. Like, I wasn't saying it like that.
Yeah, so those strategies are often, we see them in trauma bonds. People end up with trauma bonding, which means they stay attached to someone who's hurting them because it's reinforced, and then they start to develop an emotional dependency on them. That's where the love bombing comes in, and it's the sneakiest thing, and it makes me very angry. Is where, like, how can you're hurting someone, and then you're like, oh, I'm gonna turn the love thing on, and then it makes people question because they're like, maybe it's me, maybe it's my reality. It's not reality. It's a shame because it's so effective. These manipulative strategies are so effective sometimes, and it reinforces the narcissist's role, which is, I'm gonna lie, I'm gonna act in a certain way because these are ways in which I'm able to get my way and feel better about myself.
Exactly. And I think And I think it's important, well, as frustrating as that is, it is important to recognize that they might not be intentional about this, that they might not really recognize the harm that they're causing. If their core fear is worthlessness, rejection, that's getting triggered. They're just not even realizing what they're doing.
Yeah, it goes right to those defensive places or right to those places of effective manipulation, where I don't want to be hurt. I don't want to get hurt. And it's instead of that processing one's own emotion, it's getting validation through others one way or another via manipulation or whatever. But all right, we can talk about how medication can help with this. I think we kind of touched on it in saying that there's really no FDA-approved medication for MPD, but there can be some co-occurring conditions. And, I think that as we talked about with anxiety or depression, the same in our unipolar depression discussion, SSRIs are great. These include things like sertraline or fluoxetine, can help with depressive symptoms. Someone's, like I said, so much overlap, you may help with those symptoms. Mood stabilizers are actually something that I found with people who have personality disorders, and this is anecdotal. Mood variation and fluctuation can put people into patterns of where they go to for maladaptive behavior. So I think when you regulate mood and kind of help it be a little more on the narrow, you don't have to dip into the bag of tricks with, oh, I'm depressed, so I'm going to do this, or oh, I'm feeling aggressive, I'm going to do this. Some of the mood stabilizers are a little only help with like the excitable phase versus the depressed phase, which we talked about in bipolar disorder as well. And then some antipsychotics. These are things like aripiprazole. These are for someone who's very dysregulated. They could also help with paranoia. It can help with aggression as well. Some of the risperidone is really good for people who have aggressive behavior. So not sure why these even work to some degree, but it can be useful. But it's not, again, these are treating symptoms, not root cause. So a lot of times medications are only just a Band-Aid.
And you may not even be able to see the person in your office because to prescribe medications, because they do often have very limited insight. And so they may not want treatment, or they may only seek it like really in a crisis, like, a divorce or job loss. Then they get serious, they'll go. Or like in the case of my client I was talking about, that his girlfriend was going to break up with him if he didn't go to therapy. But he didn't really maybe if I was experienced in working with people with NPD, maybe that I would have been able to help, but I wasn't able to.
Yeah, and engagement, like you say, that could be challenging. Like some people report that people with MPD are more likely to stop medication early. That goes along with a lot of other mental health things where people stop things because they're feeling better. Like, oh, I feel better, I'm going to stop the medication. Or they minimize their symptoms or devalue the providers. You don't know what you're talking about.
Exactly.
I don't need this medication. And I often find even outside of NPD, people just think that medication it's defeat. But I think it's really not. It's really just helping your mental health be the most successful it can be. We take medications for a number of different things. Why wouldn't you do it for mental health?
Exactly. I tell people all the time, you wouldn't, and I may have even said this on a previous episode, that we wouldn't expect you to like think yourself out of high blood pressure or think yourself out of diabetes. Why would it be something that's a flaw that you can't think yourself out of a depression or something like that?
Yeah. And part of that is gaining a therapeutic alliance. I think it's in a place where just kind of lulling someone into a place of, you're not here to harm them, you're here to work with them, they're there for a reason of sorts. And I always say there's no cookie cutter diagnosis. Your experience is your own experience. We just put diagnosis on places to help us steer care and therapy, that just think about it as your own individual mental health experience, and that if medication helps, same with therapy. If therapy helps, then great. Then it doesn't matter if a lot of therapies cover an umbrella of different mental health experiences. That doesn't mean that you have to be, again, a cookie cutter diagnosis and that's what you are and you are defined by it, but rather that you just experience the symptoms of it. So in terms of people with NPD, can they actually change? Because it sounds like there's a lot they're working with that is a big challenge.
I believe that anyone can change. I think the problem with NPD is that you have to want to. And so in order to want to change, you have to think that there's something you need to change. And you might not think there's anything you need to change if you think everyone else is the problem. So that's really the issue. Of course they can change. If you can get somebody with NPD in your office and that really understands that that's what's going on with them, and they want to have empathy, that they want to have a more realistic self concept, like those things, then sure, we can work with that. But It's just that there's often not a true understanding that that's what they need.
Do you know of any specific therapies that would be useful for anyone with NPD?
Well, I'm not an expert in these, so I don't want to go too deep into them, but I just want you to know that they exist. And again, that people can go to therapy and get help if you do have NPD. You just have to want to. But schema therapy, transference focused psychotherapy, also mentalization based therapy. But these all do require like a long-term commitment, and any therapy is going to require a certain amount of vulnerability, right? You're going to have to tell your therapist things that you may not want people to know about you. You know, it's difficult, and that is something that is going to be a challenge with someone with NPD.
And even in your case study, it's really kind of like there was a motivation there. The motivation was he didn't want to lose his girlfriend. And in those cases, sometimes that's a nice start. But the truth is not really with fixing the narcissism, I guess, but treating shame or anxiety or the loneliness beneath it. And it might even be a little tricky, but if going down those roads of, again, this is just such a dirty labeled diagnosis, but if you were like, hey, well, instead of working on all of this, let's talk about your shame. What are you ashamed of? What shame exists for you? If they say none, then they're not ready. But if they were to say, I really feel like I had a bad relationship with a parent, and they made me feel like I have to be this way, or, you know what, I went into life being told I could do no wrong, and I went out in life and I did a lot of wrong.
Exactly.
So they're, kind of those origins.
Did it match up? It didn't match up with their worldview.
Yeah. So I think we can probably talk about more common questions involved with how people perceive narcissists, and kind of go over, I guess, like questions or common questions that people may have. We can look at some of the things that people were sending to us, I guess.
Yes, like, can narcissists love? Like, can they actually love people? And I mean, yes, of course they can, but the problem is it's often in a way that really just centers around their own needs, right? And then it's more conditional. So because they can't just love unconditionally, because what if it affects them negatively? They're not going to like
Sure. And if you take away from that, the criticizing, which often happens in relationships, that could be very triggering to a narcissist. Another question would be, what if I think I'm a narcissist? And I think the idea there is if you're really that concerned about it and self-reflective, I think you're apart from it. Can you have those traits? Of course. And that would require, there are a number of different therapies that can break traits that aren't necessarily narcissistic personality disorder, like only. It can happen in a number of different places.
And I do get asked that regularly by my clients, who often are in relationships with people who maybe have NPD, or maybe just narcissistic traits, or maybe they are just emotionally abusive, but they will often ask me, am I the narcissist? And it is true. If you're self-reflective enough and concerned enough to even ask that question, it really is probably a good indicator that you aren't.
Yeah, another question, should I confront a narcissist about their behavior? That's a tricky question, actually. You have to tread carefully. A lot of times it's best to not do it alone, because to have another person there that may be able to witness behavior, even gaslighting. You don't question reality unless someone's really good at it, where they can convince a whole crowd that you were the problem and the other person was the problem, or even the other person if you had more there. But not do it alone, safely, gently, for sure, and support should be there for you. Certainly be challenging.
I just wanted to follow really quickly on the last question about us when people ask if they're the narcissist. And when I taught, I would have office hours, right? And the only people that ever showed up to office hours were the people that 100% did not need to be in office hours. They would come and they were already, on top of stuff, but they would come to make sure they had it right, or to go over a paper or whatever. It was just, I always just thought the people that needed to be in office hours were not the ones in office hours. So it's kind of like, if you're asking if you're a narcissist, then you're not. Like, kind of the same thing. That kind of makes sense, right?
Yeah.
Okay.
Yeah, I think narcissism and narcissistic personality disorder is real. It is rare. True diagnosis is rare and complex. Oftentimes we don't get to see a true narcissist go through therapy or treatment because very few want to be treated.
They might not want to be treated, but they also don't think they need to be treated because they are not the problem.
Yeah. Yeah, I mean that's it's a very isolating. We didn't hit on it, but narcissist personality, people tend to be very charismatic.
Yes, absolutely,
Where
absolutely.
it's they want to be liked. It's that whole. I mean, if you've ever seen, I love watching people eat dinner. It's the loudest person at the table who's monopolizing the conversation and doing those things where they're devaluing what other people are saying, particularly if it takes away from what they're contributing. But it's loud. It's big. It's this bigger than their personality is. It's really rooted in early developmental wounds and defended by a whole fortress of shame and grandiosity. So I mean, that whole grandiose persona, it's just a farce. I mean, there can be embellishment to some degree, but it's really just, imagine having to live your life fake and then having that paranoia that you're going to be found out.
Yep.
So
So it's, and from a therapeutic perspective, we believe, and I have a social work background, so our code of ethics say we believe in the dignity and worth of every person. So everybody has worth. So it's not like we would say somebody with NPD is, they're just bad and they're not worth it. Like, no, they're still a person. They still are human and they still are worthy of us trying. But at some point, if they aren't going to acknowledge it or get help, you need to set your own boundaries with them.
yeah. Yeah, and I think one of the things, I had read this somewhere, is like, don't make it about you. Take the empathy component of it. Think of what it's like to be in their shoes. Imagine only having the arsenal of lies to protect you.
Wow, yes.
Like, I think that, I literally just got goosebumps thinking about it.
Yes, you did.
I need a moment. It really makes me sad to think that someone doesn't value themselves enough, to think that someone doesn't think they have the worth, that they have to be something that they're not, and they know they're not. That's why, maybe it's just my own perspective of things. People do seek treatment, do find this about themselves, that they don't believe that all that stuff is true at some point. At some point it changes. At sometimes it becomes so maladaptive that it's not an effective way of living, that it causes so much turmoil, their personal relationship, and impairs their ability to function, that they just have to come face to face with reality.
And they can do that if they can get there, then there is hope.
Yeah, it's just, and you're right, and the psychiatric and psychologic and therapeutic world, we're kind of taught to, obviously your code of ethics, like you're saying, but we're taught that they're going to be a challenge, and a lot of people shy away from it. But I do think that, we do have to look out for the people who really want to pursue change, and it might not be easy but that also is where a good collaboration comes in handy, where you have a therapist talking to a med prescriber and vice versa, and being like, no, I got your back, and really echoing what each other are saying. That's where you get the help, where I think we talked about this before, where you can get two different stories about a situation from a client, and then just coming together and be like, hey, you got to tell us what's real and what's not.
Yep. That's a really good point, because that would help with if they were putting on some type of...
Yeah, like I've had people who have come to me, and it might not necessarily be for NPD, but had their therapist have been like, they absolutely need medications, and on my end they look like so clean, put together. I'm like, I don't understand what you're talking about. And then I'll ask the therapist, can you give me some examples as to what, then when I confront them on them, they're like, well, yeah, that happened, but it wasn't a big deal. Well, now it's like, okay, now we're not opening up the can and see a little bit more. And again, some people do want to present nicely, don't want their mental health issues to seem bigger than what they want them to be. It's, like I said, useful in taking a collaborative perspective together.
There's actually a TikTok that I saw recently. Trust me, that's not where I get all of my information, but, I partake. But there was a TikTok, and they were like, okay, so they asked if there were any therapists out there, and they were like, do you ever have a client that you know you're the problem, like that the client is the problem, and then there's other TikToks, people saying that problematic person in your life, they're going to therapy, and that therapist is telling them they're not the problem. And it was very interesting because I think a good therapist is just going to, it's not that someone is the problem or isn't the problem. I think a good therapist is going to be able to not take everything at face value and kind of listen to their story and kind of see where there's, things that are incongruent or things that might not add up, and then be able to get them to maybe, recognize.
And there's a big component of therapy that's validation. So even if someone was in a situation, they still have feelings. They still have their perspective. They may not be right in it, but they're allowed to feel, and maybe kind of seeing where those feelings came from. And who would come to you as a therapist if you were like, no, to every patient you see or client you see, you are the problem?
Yeah, exactly.
So I think that it's kind of like you said, there comes a process too. And again, people become more honest the more that they trust you. And sometimes during your relationship, the honesty dissolves when the problem dissolves too. And it can change. It can change over the course of your relationship with your clients. But the idea is that, all right, well, when there's no change, and we talked about this with, are you with the right provider? When you don't feel better outside of therapy, then maybe it's either A, what you're presenting, or B, that your therapist isn't giving you what you need.
I think that's about everything we wanted to say today about NPD. Might come up again later, probably will.
Hopefully you got something out of this discussion when you think about calling people narcissistic or saying that they have a narcissistic personality disorder. It's a really deep, complex diagnosis, and people can certainly have traits, so you don't need to necessarily make a diagnosis in that case. So narcissistic personality, they do exist. Boundaries and empathy are really good tools to use within that. So protect yourself, certainly, but also know that it really takes the person to want to change themselves in efforts to move forward with any growth and addressing the NPD.
Absolutely. So everybody can change. You just have to want to. And this might be one where it's harder to get them to want to.
Yep, because of all of the things we talked about.
So join us next episode because we are going to talk about in-person therapy versus telehealth and text therapy and the whole thing. And which is better, which is worse, or whatever.
Yeah, that ever since COVID happened, everyone has kind of shifted in terms of doing in-person versus telehealth versus now text therapy.
Yeah, we'll get into all of that.
Oh, yeah. So tune in for that one. That'll be coming soon.
So thanks for tuning in.
Yeah, I'm Dominic Marano.
And I'm Katie Brzyzowski.
And don't be a narcissist. Thanks. See you guys later.